Hi, Dr. Joe Alaimo here again. I'm a board-certified chiropractor, and my practice primarily focuses on chronic pain and metabolic conditions. Today what I want to talk to you about is PCOS. PCOS is polycystic ovary syndrome, and is the #1 cause of infertility in the country, so I think it's pretty important that we talk about it. There's a couple things I want to start off with. One is that my wife went through PCOS, and we had fertility issues, and we saw the best fertility doctors in the country, but to no avail. We spent a lot of money in trying to get pregnant, and the bottom line was her body was not healthy enough to get pregnant. None of her underlying nutritional deficits were being addressed by the traditional healthcare model. They simply injected her with hormones and hoped that she would get pregnant. The bottom line is that if you can't carry a baby or get pregnant, your body's probably unhealthy or not healthy enough to do that. So we need to find out why it's not healthy and what are some of the causes. First thing I want to touch on is that polycystic ovary, some of the symptoms of polycystic ovary are decreased ability to lose weight even on a low-calorie diet, dry, brittle hair, nails and hair in unwanted places, unwanted hair growth, loss of hair, digestive problems. Now, if you're familiar with any of the other videos I've done, you probably say a lot of those symptoms probably sound like hypothyroid. And guess what? PCOS is the great mimicker of hypothyroidism. Very often women are put on thyroid medication because they're presented with those kind of symptoms to their general practitioner. General practitioner may say that the thyroid seems a little sluggish, so they put them on thyroid hormone, when in reality this is a PCOS problem. So what causes PCOS? Clinically, what we see on labs is insulin resistance, which is prediabetes. That's an inability for the body to get glucose into the cells, which leads to an upregulation of 1720 lyase, which is an enzyme in the ovaries. And what this does is causes increased production of testosterone. Now, when women produce testosterone, they get hair in unwanted places, and they get hair loss. In fact, the #1 cause of hair loss in women, 9 times out of 10, is going to be elevated testosterone. Yet this often is overlooked in the traditional healthcare model. Now, when a woman gets elevated testosterone, it's also a cardiovascular risk factor, and that means it's bad for your heart. So although you may come in because you have an inability to lose weight, or you have hair in unwanted places, or you're losing hair, I'm concerned about the cardiovascular risk factor as well. So when you have increased testosterone, that leads to further insulin resistance. Insulin resistance, again, means that you can't get glucose into your cells. This typically comes from eating high-carb diets or overeating. Also, in my women population, because they're trying to lose weight, what I see a lot is yo-yo dieting. So they'll skip breakfast, maybe have a light lunch, no snack in the afternoon, a light dinner, no snack at night. This leads to fluctuations in blood sugar that leads to insulin surges. These insulin surges, again, will lead to increased testosterone. Increased testosterone leads to further insulin resistance. This is a vicious cycle that needs to be broken. And no fertility medication on the planet is going to fix the cycle. The only way you fix this is through diet, nutrition, and lifestyle changes. So that's exactly what we did with my wife. And we got pregnant and we had a baby. So this can be done. It can be done for you. It's been done for me. So what we need to do first is get a proper diagnosis, do the proper testing to figure out what your hormones levels are like. And we run salivary testing in our office, which gives us a better, more accurate number of how much hormone is actually getting into your cells. So we do salivary testing. We also do food sensitivity testing. And we basically leave no stone unturned when it comes out to figuring out why you might be having infertility issues. Is it PCOS? Is it hypothyroid? Is it both? Because guess what? 43% of PCOS patients have Hashimoto's. So we need to figure out what's causing it, and then we'll figure out how to fix it. So if you're interested in this, if it makes sense to you, give us a call and we'll see if we can't help you out too. Thanks, and have a great day.